sitting in my office one day, and Randy Butler called me and asked me if I could possibly provide some assistance on helping him prepare a grant to the YUSA or the Robert Woods Johnson's Foundation initiative on pioneering healthy community.
I became aware of the Pioneering Healthy Community Grants through Randy Butler at the YMCA. He attends the Dyer County Health Council meetings.
The program's been going on since 2004, and to date, after this year's passed, there's over 138 towns across the nation that is named a Pioneering Healthy Community.
We actually are being asked to come back to our community and come together with groups of people and leaders to discover what we need to do to make our community a healthier place.
And part of that effort was for the team to go to Washington to a seminar or orientation.
It was 3 jam-packed days. There, they brought in a lot of the leading experts on the health field.
So the first morning I sat in the meeting, there was a presentation by the Surgeon General from the state of Arkansas.
We showed you the CDC data. Here are the childhood obesity trends over the last 3 decades. And we've gone from where only about 5% of kids were obese, same definition, to where now over 17% are in our school-age population.
And he presented some very fascinating charts that showed the migration of the obesity epidemic in our country. And he traced that through the timeline to where we are today.
Tennessee has selected, there are actually 3 communities or 4 communities in Tennessee that are part of the PHC grant. And the focus that we've chosen is childhood obesity.
And we do have well over half of our students who have high BMIs, some just in the overweight category, but some in the obese category. We see high blood pressures. We have lots of diabetic students who are type 2 diabetes, which means it's related to their weight. We see a huge need in both school systems to address children's health.
A lot of it goes to education, and a lot of it goes to parents. There's one program that's working well in other states called the 5210 project. And basically it's asking folks to get 5 servings of fruits and vegetables every day.
Limiting screen time to 2 hours a day and at least 1 hour of physical fitness.
With 0 sweet drinks.
If people want to walk to places rather than take their vehicle, how walkable is the area?
As we pave a new road, maybe we pave a bike path. As we develop a new subdivision, maybe we go ahead and lay the sidewalks in.
We have a real simple way of fixing a lot of the problems and making your community more healthy by giving people the opportunity to be able to walk through it.
I suddenly became aware that there was so much more that Dyersburg and Dyer County could be doing to help our citizens be more healthy.
We can let things happen and let things go as they go today. Or maybe we should be stepping back and saying, maybe it's up to us.
Be it sidewalks, be it helping with greenways, be it helping with community gardens, and the ball's rolling in a lot of parts of the town. And at the end of the day, it's all about education.
What we'll begin with is awareness, involvement with people and leaders, and when people decide in our community that they want these changes, then there'll probably become some policies so that we actually make some changes like we've already made about what kinds of snacks are available in our schools for kids and changes in school lunches. Those are policy now, and they started with discussions just like we're talking about things now.